Hello, everyone. Um, it's I'm a little distracted today, and I'm sure most of you aren't even going to watch this video today, but I did want to record something and decided not to postpone it. So I just wanted to talk a little bit about this week and about the difficulties that a lot of us interpreters do face when we're working with providers and situate it a little bit so that you can kind of have an idea of what the ideal situation and encounter is for us in terms of what you can do and what you really should expect from any professional. So I think the flow has always been a big one for me. So the flow of the conversation, of the communication, um, is the provider talking for too long, too fast? That's something that a lot of beginning interpreters struggle with, and they don't quite know how to ask the provider to slow down um, or to speak in smaller chunks. I think with the flow, even more importantly than that, is when the provider talks to the interpreter and sees the interpreter really as the person that they're having a conversation with and asking the interpreter to relay information to the patient. So, what you want to remember is that you're not having a conversation with an interpreter who is relaying information to the patient. You're actually talking to the patient. Yeah, it's not exactly super normal, natural rather, to talk to somebody with a third person and two languages going on. But you want to try as much as you can to keep your eye contact and your focus on the patient and ask the patient questions in English and then have the interpreter ask those questions in the language that the patient speaks. So that you can establish that connection with your patient and not be looking away and saying, can you ask her to say this? Ask her if it hurts. Um, because it creates a very difficult dynamic for the interpreter to have to then correct you, which they usually won't. And it puts the patient out of your focus and out of your attention. And they want, they want to have that appointment with you. They want to hear from you directly. So again, the interpreter is not there to relay information. The interpreter is there to help you communicate. And you want that communication to be as direct as possible with your patient. Um, I think you can expect from most professionals nowadays to have a very brief pre-session, or to at least touch base, as minimal as it can be, because everyone's really busy, of course, but to have a minimal, short conversation with you about how things are going to go if you've never worked with that interpreter before. So expect this, and if the interpreter doesn't do it, you could always ask the interpreter. Um, and their introduction usually goes along the lines of confidentiality and first person. They should be using the first person. They should tell you about that. They might talk about flow. In other words, they might ask you, well, if I needed a pause, I'm gonna have you do a gesture, and they might say something like everything will be interpreted. Those are generally the four things that a lot of trainers emphasize with the interpreters. So feel free to initiate some kind of briefing, and you can even mention that that you maybe you haven't worked with an interpreter before, but you took this class and you kind of know what to expect and you're looking forward to it, um, so that they know that as well, and just have it come from you. Now, one of the reasons for you to take this class is so that you really will talk to your patients directly, and it won't even be an issue, for the interpreters to have to kind of overcome and negotiate that with you. So I wanted to mention that, and please let me know how the course is going for you. I will be in touch frequently with you and giving some specific feedback on the discussion forum and your 321s shortly. I think beginning of next week, I'll be able to do that. And until then, keep up the good work, and I'll see you soon.